This presentation is especially meant to assist BPharm students in their studies, but it will definitely be of value to all healthcare professionals involved in the dispensing of medicines. Hello, I'm Dr. D and a registered pharmacist. Today's date is 25 September 2023 and World Pharmacy Day. One of our functions as pharmacists is to dispense medicines, but the actual picking and counting and labeling of medicines only form a very small part thereof. And these functions can actually be taken care of by pharmacy support personnel according to their scope of practice. But the actual assessing of a prescription for its appropriateness and to counsel a patient accordingly are two very important functions of a pharmacist. And a pharmacist forms an integral part of the multidisciplinary team. Remember to apply this presentation to your own situation by complying to your country's rules and regulations and according to your scope of practice. Whenever you are dispensing medicines, either on a prescription or over the counter, always keep the 5 R's in mind. You have to assess the appropriateness of medicines by asking yourself, is it the right medicines for this patient in front of you? Is it the right dosage form and dose at the right dosing interval and for the right duration? When receiving a prescription to fill, you have to follow 3 phases of dispensing. I'm going to take you through the phases and also apply a part of it. So let's get started. The interpretation and evaluation of the prescription form part of phase 1. So first of all, you'll greet the patient and identify the patient and then confirm the entity responsible for payment, whether it is a cash transaction or do you have to put it through a medical insurance. And then you'll ensure the legality and authenticity of the prescription. And first of all, you'll have to look whether there's a date present on the prescription, because the prescription is only valid for 30 days from date of being prescribed. You will confirm the patient details. Of course, the name of the patient and address should appear on the prescription, as well as the ID number. And then with the ID number, you will be able to determine the age of the patient. And then especially in pediatric patients, there should be a weight on the prescription, because one size does not fit all, and pediatric patients are not just small adults. Okay, so their doses are always according to weight. You will confirm the prescriber details. See that what's the qualification, the practice number, and the signature. And then whenever in doubt, it will be your responsibility to confirm the practitioner registration details. And it's possible to do that online. Because remember, certain doctors, say for instance dentists or veterinarians, they're only allowed to prescribe within their scope of practice. Okay, so it's very important to check the prescriber details. And yes, I mean, you cannot dispense, say for instance, anti-obesity drugs if it is a prescription from a dentist, okay, because that's not within a dentist's scope of practice. So you have to check the registration details of the doctor and ensure that the medication is prescribed within that doctor's scope of practice. Okay, so and you also will confirm the repeats, whether there's repeats on the items prescribed, and then you will interpret the type of treatment and the prescriber's intentions. Okay, so if you're not sure, you can simply just ask the patient. And this is all necessary so that you can be sure that the patient is receiving the right treatment. And whenever there is a problem with phase 1, where you cannot dispense the prescription, it it's your responsibility then to help the patient, to assist the patient to solve the problems. You can phone the doctor's rooms just to clarify some details, and then, yes, act accordingly. You will then continue to identify each medicine item to see whether it is the right dosage form, the right strength, appropriate dose or dosage, route of administration, and treatment duration. And you will ask yourself if all of this is correct for the patient standing in front of you. You continue then to assess the prescription for safety, possible contraindications, interactions with other medicines or food or diseases, and check for or confirm any treatment duplication. And then you must also keep in mind the medicine the patient is taking over the counter or perhaps receiving to treat other conditions, or what the patient's already receiving from your pharmacy, or the patient might not even receive it from your pharmacy. So that is why you have to question the patient on any other medications, prescription or over-the-counter medication that he or she is currently taking. You'll ask the patient regarding any other conditions or comorbidities you might not be aware of, and always ask for any allergies. Okay. Assess the appropriateness of the medicines for the individual and the indication for which the medicine is prescribed. And then whenever you identify a problem, you have to communicate with the prescriber and come to a solution. Inform the patient regarding the substitution of a branded medicine for an interchangeable multi-source medicine, or an IMM, more commonly referred to as generic substitution. And once the patent of an original drug or an innovator drug has lapsed, then generic drugs are approved based on the demonstration of interchangeability or therapeutic equivalence to the innovator drug through bioequivalence studies. So a generic medicine, remember, must always have the exact same active ingredient at the same strength and the same dosage form via the same route of administration, and it must all comply to the requirements for therapeutic equivalence. We are not always allowed to substitute drugs, and that will be, for instance, when the prescriber wrote on the prescription no substitution, the patient forbids, or for whatever reason the generic drug is more expensive than the originator. And then also when patients are in the ICU and they are critically ill, then substitution does not take place. Certain drugs appear on a non-substitutable list, and that will be because they've got a narrow therapeutic range or index, or they show erratic intra and interpatient responses. Examples of such drugs include dexamethasone, levodopa, carbamazepine, phenytoin, digoxin, warfarin, or nifedipine extended release. The preparation and labeling of prescribed medicines form part of phase 2. And during this phase, it's always best to dispense one medicine item at a time to avoid any mistakes. So when you select medicine from the shelf, you have to, of course, select the correct patient-ready pack or a bulk container. And then once you've done that, you must check for the strength, the dosage form, and always check for the expiry date. if it happens that the medicine has expired, remove it from the shelf. Okay, do not put it back, remove it from the shelf, and make sure you dispense an item that hasn't expired. When using a bulk container, and you have to use a counting tray, when you're going to have to dispense, for instance, tablets or capsules, it is important for you to clean the cleaning tray, or the counting tray, to clean the counting tray to avoid for any cross-contamination. And then also count the tablets or capsules according to good pharmacy practice techniques. You will then select a suitable container or polytop. For instance, some medicines might be light sensitive, so it will then come available in a amber a container. So that means also dispense it then in an amber polytop, right, to protect it against light and any degradation of the tablets. In the next slide, I'll show you what should appear on a label, but you then prepare the labels correctly and label each container or polytop. Label it nice and neat and yes, professional. It has to look professional as well. You compare then the labels with the, if you've used a bulk container, compare the label that you have typed and with that of the bulk container. This is just to ensure that you have dispensed the right medicine, okay, to ensure for accuracy and for completeness, and then to avoid any further errors or anything that can happen. It's best to return the bulk directly to the shelf then. No unnecessary containers on your working space that can lead to errors. And then what is very important then is that you have to sign the prescription. So why do you sign the prescription? Because you are taking accountability to say that you have checked that this prescription, this medicine that you are dispensing, you are taking account, you are accountable that this medication is correct for the patient, right? So that is why you have to sign the prescription. So on the label, there is certain things that should appear, and this includes, for instance, the approved name of the medicine, the dosage form, the strength and quantity of tablets, quantity of capsules dispensed. The patient name should appear on the label, as well as the complete directions on how the patient should take the medicine. The name of the person that has dispensed the medicine appears on the label, together with the business address of that person authorized to sell such medicine. And then the date of dispensing should also appear on the label, as well as the reference number or the prescription number. This is just to make it easier for retrieval, and also for any further repeat prescriptions. So you also have to add your repeats on the label, and more on this just now I will show you regarding repeats, because there are some discrepancies regarding how many repeats. So what is also important is then, what is a good practice is to place the expiry date also on the label. But it is not everywhere a legal requirement. For instance, in my country, it's not a legality. It's not a legal requirement to add the expiry date onto the label, although I think it's very good practice. Right, so that whenever patients go through their medicine cabinet, they can remove all the expired medicines and dispose of it appropriately. So what is also good then to add to a label is the expiry date and the batch number, because sometimes there are medicines that's recalled, and then if it happens to be that specific batch number, the patient can be informed that the medicine should not be taken any longer. So just check how this applies in your country. All right, what should appear, but just make sure, according to your country's legal requirements, what should appear on a label, but generally it will be all of this included in this example. So now we get to phase 3, which is a very important function of the pharmacist. The previous phases could have, under the supervision of the pharmacist, been done by pharmacy support personnel. But now when you come to actually giving the medicine, counseling is really, really important. All right, so first of all, phase 3, of course, then entails the provision of information and instructions to the patient to ensure the safe and effective use of medicine. So now you identify the patient, so you make sure that this medicine that you are giving it to the right patient. And then also, whenever you're then gonna talk to the patient, structure it to meet the needs of the individual patient. Never assume a patient knows, right? They do not have the education regarding medicine like you have. Not all of them, all right? Some might, but always structure it to the needs of the individual patient, how you will do phase 3. The information that you will then provide will be the name of each medication. So dispense one medicine at a time. Okay, say this is the medicine, this is what it's named, and it will help you to do this or that. Right, so you will explain to them what the medicine is, what it is indicated for, and how they should take the medicine. Then you also remind the patient to keep to the instructions as directed on the label, and especially when the medicine or the treatment should not be stopped abruptly. Okay, it doesn't apply to all medicine, but certain medicines cannot be stopped abruptly. And so you must make sure the patient knows what medication he or she is taking. Remind the patient then to report any side effects that might be related to the medicine. And this relates to pharmacovigilance, right? Where reporting needs to happen if there is a new adverse effect to a medicine, but even if it's a known adverse effect, ask the patient to still report it to you as the healthcare professional, and then also remind the patient to always consult with the doctor or you as a pharmacist when needing to take any other medications, because there might just be a new drug-drug interaction. So it's always the patient must inform the doctor or pharmacist or ask whether they can take this medicine with what has been prescribed or what he or she is already taking, okay, to ensure there's no drug or drug-disease interaction. So that's important to ask the patient to remind the patient to report that. Then there are general things that we always have to tell the patient. Okay, so you can, this must be something that you nearly recite, but you apply it to the patient that you are dispensing the medicine to. And that will be, for instance, remind the patient that if they have forgotten to take a dose, to take it as soon as what they remember. But if it's almost time for the next dose, they should rather wait and never ever double the dose. Okay. Then keep all medicine out of reach of children. Okay. And advise on the correct storage conditions. This is really important for the integrity of the medicine, right? So should it be kept at room temperature? Should it be kept in a dark room? Should it be kept in the fridge at the right temperature? That is also then very important to make sure that that active ingredient will stay active. Also, ensure the patient understands everything that you have told him or her, and never assume. Okay? Just remember that patient is not necessarily on the same educational level as you, so make sure the patient really knows how he or she should take the medicine, and to make sure the patient really understood you, ask the patient to repeat the instructions. Ask the patient to repeat the instructions to you so that you can correct him, or that you are really, that this patient knows. And some medicines might have quite difficult or more complicated instructions. So maybe sometimes a medicine has to be tapered up or down. So make sure the patient knows exactly how to take the medicine, and then you can ask the patient to repeat the instructions so the patient knows, but never assume. And then also furthermore, allow the patient the opportunity to ask any further questions. Okay. So that you can see that there is no misunderstanding. With this scenario, I now want to apply the 3 phases of dispensing. I cannot do it in detail, but especially when it comes to the checking for appropriateness and the counseling of the patient, is what I'm going to cover. So say for instance, you get a patient that hands you a prescription for clopidogrel 75 milligram. On the prescription appears the patient's ID number, or you will then request it because it's a legal requirement. Well, in my country it is, so just check in your country. And with the ID number, you can then determine the patient is 65 years of age. On the prescription is clopidogrel 75 milligram, 1 tablet once a day, and there are repeats for 6 months. 6 repeats on the prescription. The patient's mother suffered a stroke and the father died of a heart attack or myocardial infarction. So when you do phase 1 for legality and authenticity, you see there is a date on the prescription, and you know that this prescription is then valid for 30 days from day of prescribing, although it is a repeat prescription, right? So the scheduling status of clopidogrel allows for a maximum of 6 months supply. which means if the prescription says 6 months, it means, how I interpret it, is that initial once plus 5 repeats. Now I know there are discrepancies about this regarding the repeats of a prescription, but my argument is that a patient should see his or her doctor biannually, twice a year, every 6 months. So the maximum amount of medicine that can be supplied is 6 months. So that's why I say when you're going to put the repeat on the label, it will be 5 repeats, because it's once initial that you've given the medicine plus 5 repeats. And then now you've, just for argument's sake, you have then determined that this prescription complies to all the legal requirements. Then you have to ask the patient if he or she is taking any other medication, and remind him or her of over-the-counter medicine as well, because that can also lead to drug-drug interactions. So when you ask the patient, they will reply, or he or she replies, they're taking pantoprazole 20 milligram daily. And you then have to make sure what the patient, or determine why is the patient taking a proton pump inhibitor. Because, why do you need to determine that? Because clopidogrel is contraindicated in patients suffering from peptic ulcers. So you know, patients with peptic ulcers can be treated with a PPI. So now you ask the patient, why are you taking pantoprazole? Because he or she might not get it from your pharmacy. Or, yes, maybe the patient is getting it from somewhere, you know. So the patient then confirms it's for a heartburn, which is also known as a gastroesophageal reflux disease, or just reflux. Right, so now you know, okay, the patient hasn't got a peptic ulcer, so it is okay. Then you ask the patient if he or she is suffering from any other conditions apart from the GERD that you have now established, why the patient's taking a PPI. But why do you have to ask this? Why do you have to ask if the patient is suffering from any other conditions? Because should this patient have a liver impairment, right, then clopidogrel will be totally contraindicated in the patient, right? Should the patient have the less common disease like porphyria, then clopidogrel should be used with caution. Okay, so it's just, remember, the bus stops with you as the pharmacist. The prescribing doctor might have just missed something, so you are the next check to make sure the patient is receiving the right medicine. Okay, so now you've established, the patient then tells you now he or she have got hypertension and hypercholesterolemia, but it's under control and stabilized and well treated. You also have to then make sure for any allergies, but for our scenario, the patient is not suffering from any other allergies, although the patient mentioned that there is a sensitivity to non-steroidal anti-inflammatory drugs, for instance aspirin, because it aggravates the reflux. Okay, so now the patient has given you another clue to remember, okay, to apply. So is this prescription appropriate? Well, clopidogrel is an antiplatelet, and it's only available in a tablet form in the strengths of 75 milligram and 300 milligram. And this patient has risk factors for stroke or myocardial infarction, and includes age, comorbidities, and a family history. So the primary prevention of stroke is definitely then indicated for this patient. Aspirin would be the first choice, but as the patient has told you, he or she is suffering from a reflux disease, and it is aggravated by non-steroidal anti-inflammatory drugs like aspirin. So clopidogrel is then indicated, and the patient, remember you ask the patient if he or she is suffering from any other conditions, because you wanted to establish if there's any other maybe liver impairment that he or she might know of or be aware of, because clopidogrel is a prodrug, which means it needs to be activated. It requires activation by the liver, by the cytochrome P450 system. And certain PPIs like omeprazole and esomeprazole inhibits the isoenzyme that's responsible for the activation of clopidogrel, and this isoenzyme is your CYP2C19. And should the patient have taken omeprazole or esomeprazole as a PPI to treat the reflux disease, then you would have identified a problem, right? Because these drugs then would have decreased the effectiveness of clopidogrel. But luckily, pantoprazole that the patient is on is the most appropriate PPI to use with clopidogrel. So, for argument's sake, if the patient was taking another PPI, you would have phoned the doctor and discussed the problem. Phoned the doctor that has prescribed the PPI initially, all right, and then ask the doctor whether you can change it to pantoprazole, because the cardiologist or the other specialist has now prescribed clopidogrel for primary prevention of stroke. So this is the important role that the pharmacists play to identify any drug or drug disease interaction with the drugs. Okay? Only you will know it because you are the custodian of medicine. So by assessing and working through these steps of these different phases of dispensing, you now determine, yes, the prescription is appropriate and I can now dispense the different items according to good pharmacy practice. You inform the patient about the generic substitution and the benefits thereof and confirm the patient's choice. And then you follow all the steps of phase 2, including to dispense 30 clopidogrel 75 milligram tablets. One tablet once a day for 1 month is 30 tablets. You enter your repeats onto the system that will print on your label. It will be 1 of 6, or depending how your software works. But at the end, it will be the initial supply now plus 5 more fills. You follow all the steps of phase 3, and it has to include to remind the patient to report any signs and symptoms of. Now you have to make it applicable to the medicine that you are actually dispensing, clopidogrel in this case. So the patient has to report any signs and symptoms of abdominal pain, of blood in the stools, of dyspepsia, or any other disturbing symptoms that is unusual and only appeared after the patient has started the treatment with clopidogrel. Please ask the patient then also to avoid the use of NSAIDs, as it can increase the risk of bleeding. Although the patient has said that they are sensitive to NSAIDs, as it increases the signs and symptoms of reflux. And then, very important to counsel the patient on modifiable risk factors, non-pharmacological advice. Inform the patient about the risk of smoking, okay, and diet, okay, and because obesity can also increase the risk of stroke. So counsel the patient on this, applicable to the patient of course, and also physical activity, to increase physical activity, keep to good diet, and avoid smoking and also secondary smoking, and avoid the use of excessive alcohol. Right, so also important then to include non-pharmacological counseling points. And that is it. I really hope that this has helped you and has provided more clarity to you on the 3 phases of dispensing. If this presentation was of value to you, please give me a thumbs up or a like and subscribe to this channel to see more interesting videos to follow. Thank you and bye-bye.